My name is Tom Price, Dr. Tom Price, and I have the honor of serving as the Secretary of Health and Human Services for the Department for the United States government. And I want to offer a warm welcome to all of you as we gather for this conversation on international health regulations and the impact of the global health security agenda. Achieving results and sustaining progress. Sounds like a grand idea, right? A special thank you to our distinguished panelists and moderator, Director General Chen, and all those in attendance for your participation. I'm very pleased to share the stage with Dr. Gang-Lee Kim, Deputy Minister for Healthcare Policy in the Republic of Korea. Deputy Minister Kim, I wish to extend my personal thanks to you for the exemplary commitment of Korea to strengthening global health security and your strong leadership of the global health security agenda. Global health security continues to be an absolutely critical area of focus for governments, international organizations, and non-government stakeholders, including the private sector, and for good reason. Our experiences with SARS and Ebola and H1N1 and Zika and MERS coronavirus provided critical lessons. Additionally, we know that outbreaks can start anywhere, spread rapidly across the globe, and have potentially devastating consequences. Antimicrobial drug resistance is on the rise, and as a result, we must be prepared for all types of disease events, including those that begin with an accidental release or intentional dissemination of a deadly pathogen. Global health security is an absolute priority for the United States. We know that supporting global health security clearly benefits the United States and all partner countries, both domestically and globally. Considering the wide range of disease threats and the potential for negative impacts across sectors, we must prepare and build up a broad, multifaceted capacity to respond. Strengthening global health security and mitigating the impact of infectious disease threats require action on the part of governments, including health, agriculture, foreign affairs, development assistance, security, and defense sectors. It also requires action by international organizations and non-governmental and private sector stakeholders as well, by working together to ensure that all countries can prevent, detect, respond to, and thereby control disease outbreaks at the local, subnational, and national levels. We can minimize the threat of international health emergencies. Taking a broad, inclusive approach means that partners can bring their individual strengths to address the complex challenges of achieving global health security. In 3 weeks, we will reach the 10-year anniversary of the entry into force of the international health regulations, and much has changed over the past decade, especially in recent years. For example, when Global Health Security Agenda was launched in February 2014, its goals were twofold. One, to accelerate progress toward a world safe and secure from infectious disease threats, and two, to promote global health security as an international security priority. Now, after just more than 3 years, the 55 countries, key international organizations, and non-governmental stakeholders and private sector partners involved have worked together to help realize those goals. Among the notable accomplishments of GHSA has been the ability to develop external means of assessing health security capacities. Within the last 2 years, countries have chosen to embrace external assessment and the peer-to-peer model of the joint external evaluation. The United States is proud to be one of more than 40 countries to have completed the JEE. The JEE helps countries identify gaps and set priorities. In fact, the process itself pulls together multiple sectors within a country, helping to build and to strengthen relationships that are critical for achieving and sustaining functional capabilities. This gathering today gives us an important opportunity to learn from each other and to share experiences and successful approaches in areas that are critical to achieving our health security goals. These include successful collaboration on evaluation and planning and implementation. This is a remarkably exciting time as so many committed partners, both inside and outside of government, work to address infectious disease threats and achieve a safer, healthier world. We do this work knowing that the battle continues against biological threats. This is why the United States views these efforts as a priority. It's why we are committed to working collaboratively across borders and across both government and private sector to address these threats head-on. Once again, we welcome you to this session and look forward to working with each and every one of you toward positive and mutual goals.